What do these X-rays show, doctor? These reveal a well-aligned fracture of the distal radius involving the ulnar joint with slight shortening of perhaps 2 millimeters more or less. What about the ulna? There, doctor, is a non-displaced fracture of the ulnar styloid. This is on the anterior posterior view, which I am showing right here. The rest of the X-ray reveals no abnormalities. Is there, doctor, a name for this type of fracture? I try not to use eponyms or names. Well, how did you record, doctor, the name of the fracture in your records on that date? I recorded as a fracture of the distal radius, that's intra-articular, that involves the ulnar joint associated with an ulnar styloid fracture. Doctor, intra-articular refers to the joint, is that correct? That refers to the fracture line extending into the ulnar joint. And comminuted, doctor, refers to more than one fracture piece, is that correct? Well, it is comminuted, yes. And would you characterize this, doctor, as a serious type fracture? I'd characterize it as a fracture that needs to be followed. Why is that? Because all fractures that are put back into place need to be followed. You said, doctor, that you noted shortening on that X-ray. Would part of the body show that? And did you notice that there was shortening? If you look at the articulation between the radius and the ulna in the anterior-posterior view, you see slight shortening. What do you need, doctor, or do you mean, doctor, by shortening? The surfaces are not perfectly matched. And can that be, doctor, a problem? It may be normal or it may be a problem. And is that something you need to be mindful of when you are treating a fracture such as this? Yes. Did you perform an examination of Mr. Moran on June 28th, 1995? I did. What did that examination consist of, Dr. Sampson? Whenever you examine the patient, you start off with just looking at them and seeing whether they are in any acute distress, whether they are in severe pain. And I would characterize Mr. Moran as being in mild pain. He was not writhing. He showed that I would expect to be a normal presentation of this pain. Did you say he was not writhing? Yes. Was his hand in the cast? It was in a long arm cast. Did you remove the cast? I did not. Did you perform any kind of manual examination there, such as touching him? Well, the second part of the visit is to touch a patient, or palpate as we call it. By doing so, you assess how much swelling there is, and in Mr. Moran's case, he had moderate swelling. What was touching? Can you tell us? You assess by touching to make sure there is no impingement of the finger movement of the cast, and that's a routine technique to avoid stiffness of the joint. If a cast is blocking, you must relieve it or be sure that there is no blockage of the proper joint that should be moved. Did you form a plan of treatment at that time with Mr. Moran? I did. What was the plan of treatment, doctor? Whenever you see a patient, you don't just treat the x-rays, you treat the patient. I know he wanted to go back to work. We examined him, and he was told that he needed surgery, and I tried to explain to him why this did not need surgery at this time. Surgery was always an option at a point where a wrist became a surgical condition. What did you tell him? What I told him is that the fracture should be followed over time. There is a critical 2-week period that I follow in my practice, and during that time you must watch for swelling. You must move the fingers to obtain full range of motion, because that oftentimes leads to an abnormal result, even though the fracture may heal, and this is something very important in this 2-week period. Did you discuss with him how long the cast should stay on the arm? Defense counsel, objection, hearsay. The court, yes, overruled. Answer the question. The normal period that I would discuss is 4 to 6 weeks. What do you tell them? I explain to patients that the time varies according to the patient's age, what his bone density or structure is like, and the nature of the fracture. Do you have any recorded note that you would explain that to him during that first visit? Do I have what? Do you have a note? Yes. You are basing that on your usual custom and practice, correct? No, I think it's more than usual custom and practice, because when a patient says that he was told that he needs surgery, it needs more explanation than the average patient, and in such words, that requires a more detailed explanation, which I give to my patients. You do recall Mr. Moran telling you that he was a carpenter by trade, correct? I do. And you do recall, do you not, that he explained to you how important it was that he have full use of his hands to perform his job, correct?